There are many patients that come to my office who are concerned from a cosmetic standpoint about their jowls. And you may be someone who's in your 30s and you're starting to see some shadowing around the jawline, and you're really concerned that you're going to end up looking like your mother, your grandmother, or some other sibling in the family. But the truth is that some of these jowls are dictated by your genes, by your environment, by your habits, and just by normal aging. And some things can be prevented and some things can't be prevented. Today, I'm going to explore with you the causes of jowling, how to prevent them, or let's mitigate them, let's say, and how to treat them in the best possible way. Now, I have a lot of experience treating jowls for the last 35 years, and there are many misconceptions that are being put out there on the internet by other specialists, namely dermatologists and some plastic surgeons, and some non-plastic surgeons as well are promulgating some ideas that are frankly wrong, or let's say not proven. So I'm here today to kind of clarify the subject. The first thing to understand about jowl is that jowls are no different than other aspects of our face that are aging. And you really have to understand the anatomy of the face from inside to outside. And what does that mean? Because there are really 5 significant layers of the face. And I'm not here to give you a big lecture about facial anatomy, but you have to understand that each layer has an effect on the other layer. So for instance, the deepest layer of our face would be the bony layer, okay? And the bones around our face are constantly changing and evolving with age. Around our eye sockets, they're expanding. There's shifting of the bones of the mid-face and even along the jawline, and there's this kind of rotational effect that's occurring with age. When the bones change, since the other tissues are attached to the bone, they are dragged downward and twisted and torqued in different directions. We have to think of aging in a dynamic way, not in a static way. And so this constant evolution or change is having an effect on overlying soft tissue. Connecting the bone to the overlying muscles and fatty layers and soft tissue layers are these ligaments. And these ligaments can initially are very strong, and they have elasticity and they spring back when we're young. But when we age, these ligaments become very lax, and so there's some sagging that occurs as a result of the laxity of these ligaments that suspend and hold the soft tissue in an upward position. So as we're aging, these ligaments are descending, and some of that is manifested in around the jawline and near, which is helping to contribute to the jowl. The jowl, however, is not purely related to any ligaments alone, because there are other layers that are also sagging. One of the critical layers is actually below the skin, and there are this like fiber-like network of these fibers below the skin that helps support the skin to the underlying tissues. And as we repetitively open and close our mouth, for instance, and we are stretching these fibers, and over time, the elastin and collagen do not regenerate like they do when we're young. When we're young, there's a constant turnover of collagen and elastin, and there's regeneration of these tissues, and that helps to keep everything up and suspended. But as we age, this collagen and elastin, and there's probably other chemical mechanisms also that are degrading with time, don't allow the tissues to spring back to where they were, and as a result, they're sagging. The problem I'm trying to explain to you all is that when dermatologists are targeting just the skin, they're missing out really on the deeper layers of the face that need to be addressed. Now, if they go about suggesting that you can tighten the skin and help suspend the face, that is a false premise. You really have to go to a deeper layer in order to suspend the face upward. And there have been many different devices that have been proposed to suspend the face and to tighten the face. Some of them are actually detrimental to the face because they are actually decreasing some of the fat that's in our face, which is also an important component of the fullness and the soft tissue elasticity of our face. So if you decrease the fat in our face, you actually will look older. And using particularly heat-based devices around the jawline, near the jowls, can actually deflate these jowls and actually make them look worse. So that is why I think We have to approach this in a very anatomic way to think about how can we correct these changes that have occurred due to aging. If you're starting to have some jowls and you want to try to prevent further progression of the jowls, there are certain things that I think can be helpful. One is avoid sun. The sun itself will obviously cause sun damage to your skin, to the collagen, to the elastin, which are important in terms of creating elasticity for your skin. Your skin will become inelastic from the sun. So you need to be avoiding sun at certain times of day, and if you go in the sun, you have to wear sunblocks. The second thing is alcohol. If you drink heavily, it's going to accelerate your whole aging process. That's a known fact, and it's a habit you have to rein in because it's going to have an effect on your face. The third thing is, of course, smoking. If you smoke, smoking robs your tissues of oxygen, and when you rob your tissues of oxygen, there's an accelerated process in terms of aging. And I think it's also important to get good sleep. Sleeping has been shown to accelerate everything from aging of our brains to aging of our face. So we really have to get good sleep at night because that's an important way to prevent further aging and sagging of our skin. So if you take those tips, these are at least some ways that we can intervene to help us diminish the acceleration towards further aging and sagging. Everybody's going to sag. Everybody's going to have a jowling at some point, but we're trying to intervene in ways that are meaningful. The other thing is, if we want to improve the skin quality of our skin, it's good to use Retin-A on our skin on a regular basis, and those things can help on a daily basis to improve the quality of the skin, the tone of the skin, and decrease the aging process. Now, there are many, many things that people have been trying to use to diminish jowls. In particular, they're using either home-based devices or in-office devices that are heat-based that people believe can reduce jowling. I strongly believe that using any heat-based devices, particularly over the jowls, is just going to cause more fat atrophy, and it will not significantly tighten the jawline or the skin. So there are those little fibers under the skin. They're not going to get tightened by using anything like microneedling with radio frequency, especially at high levels. In fact, I think they're going to be a detriment to you. There are home devices that stimulate the muscle layer of the skin. I don't think they have any lasting value at all. Something called NuFace, which is like a stimulatory device to put on the skin to cause contractions of the muscles. You may feel like there's something positively happening, but I don't think anything of any lasting value is happening there. Some people have tried to use fat dissolvers like Kybella, and using Kybella right over the jawline right here actually is particularly risky because you may injure what's called the marginal mandibular nerve, which could cause a sagging of your lower lip. So I would not recommend anything like Kybella in that area. I also think that there are people have recommended, for instance, injections of fillers on the upper face that they think can lift the face upward and diminish the jawline. I think that's a total fallacy. I don't think any of these fillers can do that. However, I do have an exception here. I do think you can camouflage a jowl by injecting in front of the jowl itself in what's called the pre-jowl sulcus, which is right here. And what does that do? It breaks the line from the jowl to the chin, so that you get a smooth contour around the base of your chin. If you use small amounts of injectable along the jawline, I believe you can get an improvement in the contour, and you kind of camouflage the jowl. You're not really treating the jowl, you're really treating around the jowl to camouflage it. If you treat with too much filler on the jawline, however, you're going to get a bottom-heavy appearance to your jawline, and it's not going to give you the youthful elevation and contour of a youthful person, which is more V-shaped. But I do think it's worthwhile considering if you don't want any surgical interventions. Ultimately, though, the gold standard to fix or to improve a jowl is to have a facelift. Okay, I know everybody out there doesn't want to hear that. They want to hear home remedies. They want to think about ingesting collagen or vitamins or something else. But the answer is no. There's no magic in terms of eating well or standing on your head or anything else. Ultimately, it's going to be surgery which will improve the contour of your jawline by lifting your face upward and sometimes liposuctioning over the jowl to remove a little bit of the fat along the jawline. But in general, it does take surgery to correct a contour around the jawline and correct the jowl. And all of these other devices, even though they claim to make improvements, may ultimately cause more damage and expense, and you'll end up with minimal to no improvement at all. And so I'm strongly against using anything like high frequency ultrasound or microneedling with high energy levels, or threading, which can lift the jowl temporarily, but it will come all down again within short order. And I don't believe any of those things have any lasting value. And so I'm not in favor of them. Today I've given you my perspective on how I go about analyzing and recommending treatment for jowls. Of course, I am a facial plastic surgeon. I do have a bias towards surgery, and I recognize that, but I really truly believe that fixing the jowl on a more permanent basis requires surgical intervention. Anything else is less than truthful, and I think that there are dermatologists who basically have a hammer and everything they see looks like a nail, and therefore they're not guiding you properly in terms of making the decisions on how to really treat jowls. I know people don't necessarily want surgery, but you shouldn't just opt for something because someone says it's the best we have to offer, because sometimes their offer won't get you anywhere except an empty pocketbook. So my point is, I hope I have given you the tools to make an informed decision, and I hope that the information I gave you has been useful in terms of managing and treating your jowls.